All right, everybody, welcome back for another deep dive. Today, we're tackling something that might hit a little too close to home for those of us who love spending time outdoors. Imagine you're out on a beautiful hike, you're loving the scenery, getting some fresh air,
Yep.
and bam, you get hit with a fever, a splitting headache, maybe even a rash. Turns out it's something called scrub typhus.
Scrub typhus. Yeah, it can be pretty nasty.
And that's what we're diving into today, folks. We're to learn about the treatment for scrub typhus and some of the latest research on this disease.
Absolutely. And it's especially important for people who love being out in nature, hikers, campers.
Definitely. But even if you're not an outdoor enthusiast, understanding infectious diseases like this is just good knowledge to have.
It really is. You never know when it might come in handy.
So let's start at the basics. What exactly is scrub typhus?
Well, in the simplest terms, it's a bacterial infection that you get from the bite of certain mites. These mites, they hang out in vegetation like bushes and grasses, just waiting for a host to latch onto.
Oh, that sounds lovely. So these mites are carrying bacteria, and that's what causes the infection.
Exactly. The bacteria's name is Orientia tsutsugamushi, and once it gets into your bloodstream through the bite, it can cause all sorts of problems.
Like those awful symptoms we talked about before: fever, headache, rash.
Exactly. And it can even get much worse if it's not treated promptly.
Which brings us to the treatment. What's the go-to treatment for scrub typhus?
Doxycycline. It's an antibiotic that's incredibly effective against this bacteria.
And I was reading that the standard dose is 4 milligrams per kilogram of body weight per day.
That's right, divided into 2 doses.
Okay, so 2 doses a day. And most kids bounce back pretty quickly, within a day or two.
Yeah, usually they respond really well to doxycycline.
That's good to hear. But I also came across something fascinating. In some cases, a single dose of doxycycline has been reported as effective. Is that really possible?
Well, it is intriguing. There have been some reports of single-dose effectiveness, but more research is needed to confirm that.
So it's not a guaranteed cure-all, but it's definitely something to keep an eye on.
Absolutely. We need to see more long-term studies to understand the implications of single-dose treatment.
Makes sense. So doxycycline is the main player here, but what if someone can't take it for some reason, maybe an allergy? What are the alternatives?
Well, there are a few other options like tetracycline
Right.
and chloramphenicol, azithromycin, and clarithromycin.
So there's a decent backup plan if doxycycline's not an option.
Right, and each of those alternatives has its own dosage and considerations. For example, with chloramphenicol, it's crucial to monitor serum levels.
Oh, I see. Just to make sure it's safe for the patient.
Exactly. Patient safety is paramount.
Now, one thing that I've found a bit concerning was the rising resistance to doxycycline in some parts of the world.
Yes, that's a growing concern, especially in places like Thailand, where doxycycline resistance has become quite prevalent.
That sounds pretty alarming. What are the implications of this resistance?
Well, it means that doxycycline might not be as effective as it used to be in those areas.
So we might need to rely on those alternative treatments more often.
Exactly, and it highlights the urgent need for ongoing research to find new and effective ways to combat scrub typhus.
So it's a race against time, essentially.
In a way, yes. We need to stay one step ahead of the bacteria.
Out of those alternative treatments, is there one that's showing particular promise?
Rifampicin has been gaining a lot of attention lately. It seems to be quite effective against those doxycycline-resistant strains.
So that's good news.
And what's even more promising is that rifampicin is safe for pregnant women.
Oh, that's huge. Because many antibiotics are off limits during pregnancy.
Yes, so rifampicin could be a real game changer for those who can't take other medications.
It sounds like a real beacon of hope in the fight against scrub typhus. But what about the ultimate solution? Is there a vaccine on the horizon?
Well, that's the holy grail, isn't it? A vaccine for scrub typhus. Unfortunately, we don't have one yet.
Oh, that's a bummer.
But researchers are working hard to develop one. The challenge is that the bacteria that causes scrub typhus, it has a lot of different strains.
So it's like trying to hit a moving target.
Exactly. And that makes vaccine development very tricky.
So what kind of approaches are scientists exploring for a scrub typhus vaccine?
Well, there are a few different types of vaccines being tested. One type is called a killed vaccine, where they use inactivated bacteria to trigger an immune response.
So it's like showing your body the enemy, but in a harmless form.
Right. Another type is called a live attenuated vaccine. These vaccines use a weakened form of the bacteria.
So it's still alive, but can't cause the full-blown disease.
Yeah, like a lion that's been taught to be a vegetarian. It's still a lion, but it won't eat you.
That's a great analogy. So it teaches your immune system how to fight the real deal without getting you sick.
Exactly. And then there are subunit vaccines. These vaccines use specific parts of the bacteria to trigger an immune response.
So it's like targeting the bacteria's weak spots.
You could say that. It's a very focused approach.
It sounds like researchers are really covering all the bases in their quest for a vaccine.
They are, and the progress being made is encouraging. While a vaccine might not be available tomorrow,
Right.
the research is moving in the right direction.
That's good to know. So to recap, if you find yourself with scrub typhus, early diagnosis and treatment are key.
Absolutely.
Doxycycline is the current gold standard for treatment.
Yes, but with the emergence of drug resistance.
Right, with the emergence of drug resistance, it's crucial to be aware of alternative treatments like rifampicin.
And azithromycin, those are becoming more and more important.
And of course, the hope for the future is a vaccine that can prevent this disease altogether.
And that would be a real breakthrough.
It would indeed. Well, this has been a fascinating look into the world of scrub typhus, a disease that's more common than many people realize.
It is, and it's important to be aware of the risks, especially if you spend time outdoors.
Absolutely.
Yeah.
And as we learn more about this disease and the challenges of drug resistance, it makes you wonder, what does this mean for global health?
That's a great question.
What are the long-term implications for healthcare systems around the world? And will we see that elusive vaccine for scrub typhus in our lifetime? It's definitely something to ponder. Thanks for joining us on this deep dive, folks. Until next time, stay curious and stay healthy.
Take care.
And bye for now.